Welcome back, everyone. Dr. Abbass is back with us today. We're going to talk a little bit about a very special device for those who are suffering from obstructive sleep apnea. First of all, tell us what that is, if you could, and kind of what the treatment is now for that.
Obstructive sleep apnea is a very common condition that actually affects up to 20% of Americans. Basically, what it is the collapse of the upper airway during sleep. And that can have significant consequences in terms of the long-term physical and mental well-being of patients. The standard treatment for it is what's called CPAP. I think most people are familiar with it, where basically you wear a mask that provides constant positive airway pressure that helps prevent this upper airway collapse from happening during sleep.
Let's talk about the new device then. I always think about the CPAP, and for me, I'm a light sleeper. I just don't know if that would work for me, but talk about the new device and kind of how it's different.
Yeah, so CPAP actually is the standard therapy. It works. The problem with CPAP is that many of our patients have trouble tolerating it. You have to wear a mask on your face at night, and there's a significant portion of people who don't tolerate it. And in addition, there's some patients where it just doesn't work for them. So this device has been around for a few years now, and basically it works in a completely different fashion. What it does, it actually provides targeted stimulation to certain muscles in the upper airway. These muscles are stimulated during inspiration when you're trying to take a breath in, and it prevents the airway from collapsing that way.
For the patient themselves, kind of explain the difference between CPAP and the new device as far as how they'll feel once they've gone through the procedure.
So it's somewhat similar to a pacemaker, but it's an implanted device. It's placed usually on the right side of the upper chest, and there's two leads. One is a wire that goes to those muscles in the throat, and the other one is just a sensor in the chest. It's a procedure that takes a couple hours. It's an outpatient procedure. The recovery is usually it's easy, and usually within 3 to 4 weeks, the device is activated and we can start therapy.
And you guys have seen really good results so far from it.
Yes, we have a significant amount of data, and actually from 90 to 95% of people do report significant improvement in terms of their overall physical and mental well-being.
For those who are out there, they hear this and they think, okay, this might be for me. What's the next step? Is it for everyone, or are there certain patients that may not work for, or what do they need to do in their next step?
You do have to meet certain parameters. It's for people who have moderate to severe sleep apnea. So there are certain other parameters that have to be met as well. There's some anatomical factors that we have to look at to make sure that the person is a good candidate for the procedure and that person would benefit from it. So typically, the patient will come in and they go through a thorough evaluation that might include a sleep study and an upper airway endoscopy as well.
It's so exciting to hear about this technology because we hear so much about sleep and how important it is for our overall health and weight loss and heart health and those kind of things. I mean, this could be really life-changing for folks, couldn't it?
Yes, absolutely. This is really a game changer for some people. Sleep apnea is a very common condition and becoming more common. And this has really been a life-changing experience for many patients.
Okay, and then get that sleep study and get a hold of you guys at 419-998-8244 and take that next step. Thank you so much, Dr. Abbass. We appreciate it.
Thank you for having me.
You bet. Nice chatting with you. We'll be back right after this.